this video, we're going to talk about what to do if your dog is having a seizure. I'll be sharing what you should be doing to help your dog, as well as what to do immediately after the seizure. Hi pet parents, welcome back to my channel. If you're new here, my name is Charlie and I've owned dogs my entire life. I have a 4-year degree in animal nutrition, decided not to go to vet school for my sanity, and in this video, I'm going to talk to you about what you should do if your dog is having a seizure. And please disregard the washing machine noise in the background. Hopefully you can't hear it. It's Memorial Day when I'm filming this, and you got to take advantage of those days off work. So here we are. Unfortunately, I do have a lot of experience with dog seizures. One of my current dogs, Charlie, yes, he does have the same name as me, but he's been having idiopathic or random seizures now for over 2 years. There's really no rhyme or reason to them, and we do keep a log, and you can see from the photo here that it's just completely like one time he went 10 months without having any, and then he'll have 2 in the span of 24 hours. So it's just very random, which is even more frustrating than having a known cause. But one of the things that I found missing from the videos that I've seen when I was doing my own research on dog seizures was what we as the human and the dog owner should be doing while the dog is having a seizure. So the biggest thing to remember when your dog is having a seizure is to just stay calm. And I know this is the most difficult thing to do because it's absolutely heartbreaking as a dog owner to watch your dog going through something like this. So Charlie has grand mal seizures, which is where the entire body has tremors. His mouth will be hanging open. He will be foaming at the mouth. His legs are going. He's paddling is a common term that they'll use. And so it's very, very distressing as a dog owner to watch your fur baby going through this. But the biggest thing you can do is to just stay calm. And one thing that our vet told us that always stuck with me that really helps me to stay calm during these episodes is that the dog doesn't feel anything during the actual seizure itself. So they're not in any pain. It just looks worse than it is. Make sure that you're in a space that is not going to be harmful to the dog. So this includes making sure that your face and your hands stay away from their mouth because they are out of control in this situation and they don't know where their mouth is, and you don't know if they're going to bite, whether intentional or not. The other thing that you should be doing yourself is not restraining the dog. So just leave them alone in the space that they're seizing and just keep a close eye on them. Do not try to hug them. Do not try to restrain them. The one thing that you should do if you do need to touch the dog is to remove them from a situation where they could harm themselves. So this includes like if they were seizing beside a pool, at the top of the stairs, close to sharp objects. Maybe there's a glass top coffee table that has sharp edges that they could hurt themselves on. In this instance, it is okay to move the dog away from those types of hazards. But otherwise, just let them seize, watch them closely, and just stay calm. So also remembering for you, remember to breathe. I understand this is very, very difficult. It's very distressing seeing your dog in this situation, but this is really what helps the dog most. The other thing you should do while the dog is seizing, if you think about it and if you have access to it, is to track the duration. So track the time that the dog is actually seizing, and then also be writing down the date and keeping a log of the times that it's occurring. For us, unfortunately, Charlie seems to have his in the middle of the night, anywhere between midnight and 6 a.m., or he'll have them during the day when Andrew and I are at work, and so we're not able to track the actual time frame. But I do always track the date, and I'll put a picture up. I just take it in the notes app on my phone. And I know that our vet is always really appreciative that I have this log. So if you do think about it, or if you remember after the seizure happens, just jot it down. You can use the notes app like I do on my phone, piece of paper, whatever method you want to use to track it is fine. The other thing we do is we keep a towel nearby. We actually hang it over our banister at the top of our stairs. So this just helps us to quickly capture the pee, to hopefully keep him a little cleaner so that there's less time that we have to spend after the seizure cleaning him up as well as the house. And again, if you want to talk to your dog during a seizure, that's fine. Just use calming, comforting words and calm tone of voice. Just keeping in mind that they can't hear you, but it may make you feel better. And if that keeps you calmer, then that's fine. So what should you do immediately after your dog has a seizure? So oftentimes when a dog comes out of a seizure, they will be very disoriented. They'll also be very overheated because the seizure causes their body to heat up from the inside. So we will immediately take him outside. Oftentimes too, too, they'll have to do their business again. Even though he just peed during the seizure, he often will have to pee again afterwards. And because his body's overheated, he will also drink a lot after the seizure. And so we allow him to drink as much as he wants and then take him outside again to do his business. The other thing to keep in mind is to keep them cool. Again, the seizure causes their body to overheat from the inside. So if it's cooler outside, this is a great chance for him to lower his body temperature naturally. You can also use ice packs, gel packs, and other things, but you want to make sure that you're not causing the cool down to happen too rapidly, because this can potentially send their body into shock. So we try to do it using the natural air temperature to make it a gradual cool down process. And also we'll walk him around the yard a few times just to give his muscles a chance to decompress and to make sure that he's reorienting himself to where he's at, and to also keep the blood flow moving. And during this process, after the seizure, it's again really helpful if you are able to stay calm, just act as if nothing happened, that this is just a normal trip outside. That really helps the dog to reorient themselves quicker and to not panic. And I know for Charlie, he especially gets anxiety when he feels like he has done something wrong. So when he notices that he has peed in the house, he gets very, very anxious, and that just leads to a longer period of time to calm him back down to the point where we can either go back to sleep or he eventually goes back to sleep. So again, the towel is a good idea just to keep him clean, to keep your dog clean, so that if they do have anxiety about going to the bathroom in the house, that they don't notice it as much because they're clean. And it's really, really important that if your dog's seizure has lasted longer than a minute or they're unresponsive at the end of the tremors, that you immediately take them to an emergency vet or your local vet if it's during office hours, because this is a sign of complications resulting from the seizure. If you guys enjoyed this video, you're gonna love the one where I talk about what we feed Charlie to help keep his seizures less frequent. So you can check that video out right over here. And don't forget to hit that like button, consider subscribing, and hit that bell notification so you're always notified when I post another video. I upload a video every single week, and so you don't want to miss one. And don't forget, dogs are the best.